My primary goal of writing the Essentials of Health Economics is basically I wanted to make health economics reachable to undergraduate students as well as graduate students in other areas of health and health administration in medical areas where people don't have a lot of economic background possibly and also very often not have mathematical backgrounds. So, in a sense, it creates a situation or a vehicle actually for students to better understand what's going on in the health economy, applications to health policy, world politics, and world health economic systems from a non specialist point of view. The significant updates for this edition are basically that there's just so much excitement right now in health economics and in health policy in the country and worldwide. There's so many things that are happening that this is a major update from the second edition. It includes a large amount of information about how economics can be used as a lens for policy analysis, both locally in the US, statewide, as well as in the international arena. Also, it looks at technological advances. What do we do to assess technological advances? What do we do to understand and improve the healthcare workforce? Since the pandemic, there's been a lot of burnout. There's been a lot of changes in technology for the good and the bad, actually, and also a lot of movement in terms of what to do for the next public health crisis or natural disaster. So, also included in this third edition is a complete case study about COVID 19. Now, not just because it's COVID 19, but COVID-19 was a watershed of technological advances that we've never seen diffused in our society at such an unprecedented rate. There were so many benefits that came out of that in terms of medicine and advances in tech that it's hard to even get our heads around it without really fully analyzing it in a case study. Other things in that case study are lessons learned. What have we learned nationally and internationally to actually deal with global pandemics, local epidemics, and other public health crises? These are going to come up. People have to understand what's going on, and also they have to understand what do we do in terms of the competing demands of, let's say, a crisis in the system versus business as usual, and how many resources can we allocate to both of those at any particular period of time. So as a recap, we see a lot more in terms of policy, international policy, comparisons of the US system with peer systems in the world, as well as a case study of system resiliency and emergency preparedness. Those are the big ones, and plus tons of updates in terms of what's going on in the workforce and technology. I do provide a lot of national and international comparisons in the book. I think it's really important to do so because we're really in a global health economy. Whatever happens in one country, often, if not every time, affects other countries nearby, if not across the world. So, in that sense, what I've looked at and I've explained in the third edition, which is a big departure from the second edition, is looking at comparing health status of the US system with peer countries, Canada, France, Germany. And I also bring in Singapore because they're a guiding light in terms of their health status and what they do with their resources and how they are so cost effective in their use of resources to really improve their population's health. I think it's a really good example of what you can do with a much smaller budget. Other things I look at in terms of the global comparisons is looking at policies. Basically, I look at the policies because we all have very similar problems in our health systems. the aging population, workforce shortages in key areas, whether it's geographic or in specialties, or even something as basic as primary care because of policy changes to give improved access to care. There is pressure for the primary care providers to really come on board, be there, and also to increase that important level of workforce, as well as the allied health sciences and the allied health professions. Other things I look at in terms of global aspects are in terms of what's going on in terms of technology assessment, and healthcare reform. We're all trying to move at some level toward universal health coverage. Some are more successful than others. The US can definitely learn a lot from other countries that have more successfully done this. I think we have moved in great strides. And then, on the other hand, other countries can learn a lot from us, from our technological advances and our biomedical research. I include case studies in this particular text as a new feature in the third edition. I have found that students really enjoy these case studies. Now, I must tell you, these case studies are real life examples, industry studies, uh, healthcare workforce studies, actual people going through intensive care units, hospital systems, hospital mergers. Students have found this really helpful because this is a sense like a little lab that they can do to apply the concepts, which oftentimes seem a bit arcane or sometimes even obtuse, to this is how it really works in the real world. And this is how it really can be seen and analyzed and evaluated using the tools of the chapter and even previous chapters to look at a very complicated real world, multifaceted question. And through the leading questions that I give for each case study, what I call them questions for reflection, students are led down the path of critical thinking for those particular applications. So students really like them. They feel it's very refreshing to actually do that rather than just passively try to just go through questions and answers of the concepts that are being presented in the chapters.